That was a blooper. Hey everybody, it's Friday. That means the Doctor's In Live with TOA is back in action in our downtown studio. And as you notice, we have a high-tech logo sign here. Kevin's here. This is Dr. Bartley McGehee. I'm Gray Stallman. I'm your host. Looking forward to talking about today's topic, which is basically we're going to talk a little bit about the whole shooting match of continuity of care from coming into the office with a problem and what we can do to help you all the way through. And Bartley's really got a lot of experience with that in our Sports Performance Center office down in Franklin. Anyway, as always, Dr. McGehee and I are both fellowship-trained orthopedic surgeons. However, today we are not your orthopedic surgeons, so please consider this information to be for information, education, and maybe a little entertainment purposes only. This is not medical advice. If you have need for a musculoskeletal practitioner, please go to TOA.com. You can learn about TOA, what we do, who we are, where we are. We have a big selection of topics and tips, videos in the media center. You can actually go on the website and initiate an appointment. So the information is there. TOA is the largest, biggest, and oldest musculoskeletal care practice in the state of Tennessee. We're now almost 100 providers. Good gosh. Spanning from Knoxville to Columbia. So if we can help you, we will. Anyway, any other topics before we start? I guess not. So this is Dr. McGehee. Dr. McGehee follows in our guest appearances of my most jealous. I'm in awe of their facial hair. He still falls behind Dr. Rubright, who we saw a couple of weeks ago.
You didn't tell me this when you said
but
it's not fair.
He's got a great beard. I can never grow a beard, so don't let the baby face fool you.
Yeah.
Dr. McGehee's been around for a long time, actually. And Bartley, thanks for being here. Thanks for letting me tease you a little bit. So before we get started, why don't you tell everybody kind of a little bit about you, kind of who you are, where you grew up, what kind of training, what your interests are, that kind of stuff.
Sure. All right. So Bartley McGehee, grew up here in Nashville, went to MBA for high school, then Vanderbilt for college, stayed at Vanderbilt for medical school, then went to orthopedics residency in Atlanta at Emory. Finished up with fellowship in South Carolina in sports medicine and shoulder reconstruction. So that's the gist of my practice is mostly sports medicine. The reconstructive side is that I do shoulder replacements. And people always ask sports medicine, what does that mean? Is it just athletes? And my answer is usually, well, it's, yes, it's athletes, it's teams. We help take care of lots of teams through TOA, but it's also anybody who's trying to be active. And so the majority of the patients who need our care are really not involved with team sports. So lots of rotator cuff injuries, things like that.
Yeah, that's how I was kind of trained at Vanderbilt with the sports medicine guy. When he came, he said, I treat everybody in the community as if they're an elite level athlete and give them the same kind of care. And I think that's what we do, and that's what you do. And
right. Let's
face reality. There are very few professional athletes in Nashville to take care of. And so we really take care of everybody in that realm. So you're primarily in our Franklin office,
That's right?
And then you also go to the office at Harding, correct?
Yes, we go to the St. Thomas West.
St. Thomas West office. That's
and
right.
I spend a fair amount of time actually in Cookeville too.
Oh, that's right. I forgot about that.
We help take care of Tennessee Tech, and that's and the whole community there is just wonderful. So it's a neat place to go to.
Awesome. So I can't remember if this topic was yours or if it was somebody else's that gave us this, but what was the topic officially called?
Cycle of care, from injury to return to activity.
Thank you. This is our predator, our production editor, our producer editor, Casey, and she's helping me out because she keeps me on track. So the cycle of care. So you're in a position, particularly being that you practice a lot at the Sports Performance Center office in Franklin, to really see that whole progression of care. So give us an idea of how you approach something like that and how TOA approaches or tries to approach that kind of continuity of care with all the services that we offer.
Sure. I was actually kind of thinking about how we discuss this topic when I was driving over. And one of the thoughts that came to my mind is that when people come in with an injury and you start talking about how you're going to treat it, one of the hardest questions I find to answer is, well, how long is it going to take me to recover, right? So whether it's a knee surgery or just a knee sprain or anything like that. So I mean, when somebody asks me that, I kind of have to break it down and say, well, we're looking at phases of recovery. Let's take a basic surgery like a rotator cuff repair. How long is that recovery? Well, how do you define recovery? Is it just when I'm off my pain medicines? Okay, well that's a few days, hopefully. When am I out of my sling? Well, we know that answer, 6 weeks. But what people really want to know is, when am I getting back to all my usual activities? And that's so dependent upon, first of all, what their injury is, what we've done to fix them, how they rehab, and what their activities are. So there are a lot of things to consider there. What I like about the setup we have now is that we can help people through that whole recovery and just do what they need, or take them all the way back. Let's say they are an elite athlete and they need to get back to performance training. Well, we have that offering too. So the basic stuff, the physical therapy that almost everybody's going to go through. We've got a great integrated therapy department right there. So lots of folks will take advantage of that, and that gets them through these first 3 phases or so of recovery. And then if they're looking to go back to sports, maybe we move them over to the sports performance side and say, okay, well now you're ready to do stuff that doesn't really fall under traditional therapy. It's really more performance type stuff, and maybe that's what you need to get back into whatever you're trying to do.
Right, yeah, and so as you said, the recovery is not just pain or wound healing or protecting the injury or the surgery, but it's also moving past all that medical stuff and really getting toward the performance side of things to see if we can get you back as close to you were, or better in some cases,
right,
in the right lucky circumstance.
I don't want to discourage people sometimes. Like, if we're talking about a shoulder, the truth is that it takes a long time to get to be as good as they're going to be. So I mention that to people. I'll say, listen, it's, I'm going to protect this shoulder for 6 months before we have you doing everything with sports. But realistically, this shoulder is going to improve for at least a year after a cuff repair. So does that mean they're going to be in therapy that long? No. Hopefully at that point they're back to doing their activities, just it doesn't feel normal. So I really struggle with kind of conveying to people that recovery is not cut and dry. It's not one day we released you back and you're done.
I've had that difficulty too, because you can see it in the person's face when you say, yeah, it can take a year or more to get as good as you're gonna get, and they look deflated and they say, you mean I'm gonna have to be limited or in rehab or whatever for a year? No, that's not the case. I mean, I deal with this all the time too, because the body just doesn't snap back and become normal anytime soon. And let's face reality, what we're doing is not normal. We're not making the body normal. We've talked about this on a number of previous episodes where we're doing what we can to reconstruct and rebuild what's broken apart or what's failed, but it's not what God gave you. And so we're very lucky. We're very fortunate. The body does respond well to much of what we ask it to do.
Absolutely.
But it does take time, and it's really the hard work is putting in the work, not the surgery. That's not the hard part.
Right.
It's the rehab, recuperation, recovery, and then the expectation thing afterwards, right?
Yeah, no, I see people back, and I use that almost exactly. They'll come back and they're 3 months out from a cuff repair. They say, "You did a great job, Doc." I said, "Well, listen, I did my part, but you've done the work getting it better. Because if I fix it and then you don't rehab, you're going to be stuck with a stiff shoulder that doesn't work well." So, and even beyond the therapy, we talk about how important it is to do your exercises at home. It's not just what you do in formal rehab.
So tell me a little bit about kind of in the ideal patient scenario in your venue down at the Sports Performance Center. Somebody gets injured. Let's say they have potentially injured their shoulder, maybe they've torn their rotator cuff. Kind of walk us through kind of the basic steps of what happens in your practice for that kind of problem. We've talked about rotator cuff repairs in the past, the techniques of that, but
Yes.
kind of what the patient would expect.
Okay. Well, so using a shoulder as an example, which path we take. In a perfect world, we would do a diagnostic test and know what the answer is immediately, right? But we know we have to work within the real world of insurance and whatnot. So, sometimes I have to do a little explaining around. Somebody comes in with shoulder pain, but they didn't have an injury, just this pain sort of came up out of the blue. Well, and I have to tell them, okay, the good news is that doesn't necessarily mean that you have a rotator cuff tear, but it also means that you're probably not going to meet criteria to get an MRI right away. We're going to have to start with some rehab, because if it's an overused thing like bursitis or a problem like that, it has a very good chance of getting better without needing surgery. So we'll go down that route and go to surgery. If somebody comes in, they just had an acute injury, and now they have significant weakness. Well, in my mind, I'm now concerned about a rotator cuff tear, and I don't want to delay getting that answer, because we know that repairing those does better if you do it early.
Yeah.
Yes. So then we get the MRI, and then we'll visit and go over that. And this is probably the best example of one where once we have the MRI back and we see a problem with a rotator cuff tear, we go ahead and have a conversation. So always, we're talking about surgery. What are the non-operative treatments? And so we say, okay, well, you don't have to have your rotator cuff tear fixed, but if you don't, you're likely to have persistent weakness and probably have persistent pain. So, in other words, our outcomes data shows an improvement in folks who have it repaired versus don't. Or small tears tend to get bigger over time if we don't treat them. So we have that conversation. Assuming then we decide to do surgery, well, that gets scheduled. It's obviously not something we just do in the office while they're there. So we'll schedule that out. My routine is actually to have them just rest in a sling for 6 weeks if we do a rotator cuff repair. So we have them doing some home exercises, but they're not involved in formal therapy. And then at 6 weeks, come out of the sling, and now now you're working with your therapist a couple times a week and doing your home exercises. And this is where the magic happens in terms of getting the motion and strength back.
Right. Yeah. If in the ideal world, TOA would love to have the ability to have all those products and services in every office, but it's just not feasible. MRI machines are expensive. There are certain rules and restrictions about that, so not every practice can have an MRI machine in the office. Same thing with surgery. We would love to have surgery centers in each of our facilities. It's not going to happen because of state laws and whatnot. So, but we believe, I think you probably believe as well, that by far and away it's more advantageous for a patient to be kept within our system as much as possible, particularly on the rehab therapy side, because we have so much control over that. We've talked to therapists on this show before, and they really feel it's important to be able to walk down the hallway or throw up an email to one of us who's operated on and say, "Doc, is it okay if," or "What did you do here?" And that connection between internally at TOA, I think, is a huge advantage over other practices around that don't necessarily have that venue of management. Same thing with our MRIs. I mean, if there's a problem on an MRI that's a scary problem, we get direct communication from the radiologists that work with us, and immediately we can go up online and see our own MRIs rather than potentially having to wait for a disc to come in the mail or whatever.
Or track down a report.
Exactly,
Yeah.
exactly.
No, so I think on the rehab piece, you hit the nail on the head. It's communication. So the therapists, especially in Franklin, where it's small and we're literally right across the hall from them, they'll come over several times a week and just say, "Hey, I've got so and so over here. Did you want me doing this or that?" And that's really helpful. So instead of a therapist, maybe somewhere else is like, "Well, I don't think they want you doing this yet, so you can ask it at your next appointment." Well, now maybe you wasted 3 weeks where you could have been doing more.
Right.
So I think that is a big benefit.
It is a big benefit. It's a benefit in my practice too. It really is.
And not to mention also that we know that the therapists that work with TOA have expertise in musculoskeletal problems that we treat. So, not to malign home health or anything like that, but people ask, "Well, can I do my therapy at home?" And I'll say, "Well, okay, again, you've got criteria you have to meet to do that, but also you're going to be seeing a therapist who mostly is rehabbing people after hip or knee injuries. They're great with the gait training and the balance and stuff like that, but how many rotator cuffs do they rehab in home health?" The answer is probably not many.
If any.
If any. And I think there are also other therapy centers that just don't have the breadth of orthopedic experience to really see the stuff over and over again and really get good at it.
Yeah, I think that's a really good point because, most therapists in our communities are good. But if you do it all the time in a concentrated way, you're better at it. And with direct communication with surgeons every surgeon has their own kind of little preferred way of doing things. They know what each of us like to do, and it makes a huge difference in the patient's outcome and expectations because everything's consistent. Every time a patient hears something from one of us, it's consistent, pretty much, and that's a big deal. How have you liked the sports performance side of things with the addition of the actual we'll call it aftercare of the sports performance side of things?
Well, I feel like it's got great potential. We sort of opened that at a bad time.
Yeah.
Considering we moved into that office in February, and then the world fell apart
immediately
in
closed.
March.
Yes.
So I don't feel like we've had a chance to really maximize the way we're going to use that facility. I do see folks working out there a lot, and we've definitely referred people over. But I think we've got outreach programs now that are going to be going to schools, and so not even just the injury recovery, but more the performance training piece that I think we've got a lot of opportunity there to.
Yeah, we're actually going to be establishing the same type of venue in our Lebanon office that's under construction, being constructed, soon to be finished, maybe finished, I can't remember. But we actually built that office with this kind of model in mind, and I think that's probably going to be our model moving forward. If we build new offices or move to different offices, we're going to want to have this type of soup to nuts as much as we can control over patient care, because I think ultimately we want to be in the community, we want to be accessible, and it provides the most continuity of care that I think you can get.
The other thing that's been interesting being in that building, we were for years, and you came to our office in Franklin a long time
At the Williamson
ago.
office,
Yes.
right?
So we were attached to the hospital, and that was fine. That was sort of that's the only office all the places I've ever worked were attached to hospitals, right? So it's different being in this off-hospital campus type environment. You guys probably have a taste of it here in one city. It's not a medical, campus necessarily. But now that we've opened our urgent care, and we're all during the day, we're seeing walk-in patients. But we see all these, athletes from. There are so many kids in Williamson County involved in volleyball and basketball and dance and
Cheerleading,
cheering, all that based in that building, and it's amazing. And so it's been, nice that we're accessible for them when they have a problem. But it's also just a little bit different environment than being at the hospital.
Yeah, that is true. We've been to the Sports Performance Center, but we never really talked about the remainder of that building, which is a big building filled with various venues for other independent businesses, servicing, particularly kids, their sports and athletic and activity needs. It's really a vibrant place to be. We should probably go down there and kind of take a video tour of all the other venues.
Go on a tournament weekend when you can't even find a parking spot.
Yeah, exactly. Because it literally is, for those kids and parents, a one-stop shop for an injury or problem, which is really unique in this community. You can't find that anywhere. I'm glad you mentioned the urgent care, because we have urgent care at most of our offices now, which is during the day or after hours, most nights and most weekends. You can actually come in if you've hurt yourself and basically walk in and see either a physician's assistant or more likely an orthopedic surgeon to manage your problem, rather than going to, and don't get me wrong, I'm not disparaging anybody, going to the Minute Clinic and seeing a nurse practitioner in the Walgreens or the Vanderbilt walk-in clinic or something like that. We just are focused on musculoskeletal care, and I think we have the ability to really progress people through their evaluation, management, and care much more quickly.
Absolutely.
What do you see as the in the future of this kind of what would you like to see is probably a better word, being a younger guy in this world. I'm an old guy in the musculoskeletal world. I'm one of the old guys. But what would you like to see? What do you think you're going to see? What are you seeing across the country as far as the ability to service patients that you deal with on such a regular basis? What's out there on the horizon?
You know, I should probably come up for air every once in a while and check. I'm not sure what the big nationwide trends are. I think they are sort of this comprehensive, the trend is towards the comprehensive care model, and so we're certainly trending that direction. I'm not sure that I see any big sea changes ahead in terms of what we do. You know, a lot of
Yeah, we're kind of on the front line as far as that goes.
yes,
right?
and I would say some of the, you know, there is a shift to move as many procedures out of the hospital as can be done. So in what I do with shoulder replacements, we're starting to do those as outpatients instead
Oh,
of,
good.
you know, traditionally in the hospital. But that's an evolution over time, not something that's going to happen overnight.
What do you think in the shoulder replacement outpatient situation? What are the barriers you see for not being able to do that?
Right.
I mean, other than we haven't done it like that before.
Yeah. You know, so when I started thinking about it, first of all, the barrier for a long time was that insurances wouldn't cover it as an
Yeah.
outpatient. And then when that barrier was sort of lifted, and I started saying, well, what about these patients makes me feel like I need to do them in the hospital? It's not that it's it's not brain surgery or heart surgery where I'm expecting medical complications. The reason why we've continued to do them in the hospital mostly is, I think, fear about pain control afterwards. When I keep people in the hospital overnight, because almost all of mine, when I do them in the hospital, will go home the next day. It's not that we're checking anything we've done with the shoulder, you know, that we're waiting to see if this works out or not. It's all about pain control. Are they comfortable enough to go home that day one on oral pain medicines? And the answer is that most of them are. And so that next leap is, what can we do in the surgery center to do it as an outpatient that provides enough pain relief where we're not worried that they're going to get home that night and have unmanageable pain. And so there are, the anesthesiologists are great about, you know, coming up with different block techniques and different cocktails of drugs they can inject with the block to give longer acting. And I think that's really what's going to help us move more to the outpatient.
Yeah, that's what we found. The spine is in a little bit earlier progression than the big joint replacement world. The key has been a couple of things: picking the right patients so they're healthy enough. Number two, educating the patients about what to expect, and managing their expectations. And number three, the anesthesia piece, to preemptively help people keep from getting sick to their stomach, being comfortable so that we could mobilize them quickly. And we found that a really big percentage of people, you just don't need the hospital. I always tell my patients, you know, who say, oh, I want to stay in the hospital 3 or 4 days. I always tell them, no, you don't, because the hospital's where sick people are. And our surgical patients, for the most part, except for the frail ones, aren't sick. They don't need the hospital, and they are at risk in the hospital.
Exactly.
And so the advantage of outpatient types of procedures in the sports medicine world, you guys, you know, were the outpatient guys from the beginning,
Right.
shoulders, knees, reconstruction, thing like that. Now spine, then spine, now big joint replacement is, I think patients get out of the facility, get out of the surgical world safer and easier, probably less expensively, and we're not seeing a drastic increase in complications or things like infections or bounce back to the emergency room because of pain control, things like that.
Yes, it's funny you talk about sports medicine. You know, the 20 years I've been in orthopedics, it's all been outpatient.
Right.
ACL reconstruction is an outpatient, but I still see some patients every once in a while of like Pinky Lipscomb's, and you know, he was one of the pioneers in Middle Tennessee of sports medicine, and you know, so they've all got the Pinky special incision, and they're like, oh yeah, I spent a couple nights in the hospital. Yeah, and they worked. I mean, they worked. Of course, he was dealing with technology. You know, they didn't have the technology we have, and so they did a great job with what they had. But even that has evolved, you know, to where it was inpatient work initially, and then got moved to outpatient.
Well, I remember when I was a resident and we did an anterior cruciate ligament reconstruction on one of the women who was playing for the Vanderbilt basketball team, and that was when they were competing neck and neck with UT. And I literally, here I am, the resident, third-year resident. I spent all night in the hospital room with the elite athlete to keep an eye on her. And she didn't need the hospital. She certainly didn't need me. But that's what we used to do. I mean, we used to do lumbar discectomies in wounds this big, and they spent 4 days in the hospital. Now they're this big, and they spend 2 hours in the facility. And it's a far different thing. Anyway. Well, Bartley, thanks. This was a lot of fun. If you come up with any kind of topics that you'd like to talk about, that you're interested in, that you'd like to highlight, come back. This type of thing is fun. It's well received. The folks watching seem to really like it. We kind of knock it out of the park as far as the actual statistics, according to Facebook and whatnot, which means you guys are really loyal to us, which is awesome. Thank you. But in the meantime, so go spend time with your family this weekend. Don't do anything crazy, okay?
Like travel to Ohio for soccer games.
Oh,
Yeah.
Is that where you're going?
Yeah.
Oh, great. Well, I didn't have kids for a reason. But I've got to buy them now when they're taking care of me when I'm old. So you have automatic
Maybe.
elder care, but I don't. So. Anyway, so everybody, thanks for your time. I hope this was interesting. Once again, go back to TOA.com. You can learn about all aspects of Tennessee Orthopedic Alliance. We have imaging, we have therapy, we have hand therapy, we have the Sports Performance Center, we have capable and outstanding physicians and extender providers like PAs and nurse practitioners to help people just like you with your musculoskeletal problems. So don't let it drag you down. Let us see if we can help you get back to the life that you're looking for. Go out there, live your best life, have a good weekend, take care, talk to you later.